A very good afternoon, all. So, very pleasure to see you all after a short break. So, yes, today we are going to deal with the 30th session of Foundation Course in Palliative Care, and as you know, today is our last session. So, today we are going to deal with a very different topic, spirituality. So, we have all heard about spirituality, and many of us think that it is something very related to religion. So actually there is a very great difference between spirituality. We have a very eminent faculty today here for dealing the session, Dr. Abhijith. Dr. Abhijith passed his MBBS with honors from RGK Medical College, Kolkata in 1990, MD in Anesthesiology from All India Institute of Medical Sciences, New Delhi in 1995. So after long years of practice in the field of critical care medicine and being disturbed at the state of lonely and undignified death that patients face, Dr. Dham embraced palliative medicine in 2006 from Cardiff University. He has also done a course in advanced Vedanta, care of the elderly, and contemplative practice in end of life. He is also a national faculty of the Indian Association of Palliative Care, and he has also published a book, Wading Through Quicksand, Palliative Care, Spirituality, and Sanatan Dharma. So it is a very privilege and pleasure to welcome you, Doctor. Over to you.
Thank you, and good afternoon, everybody. And I think let's get down to business.
Sir, could you please switch on your video once again?
Yeah, just a minute. Yeah, that's fine.
Sir, perfect. Thank you.
So good afternoon once again, and I'm led to believe that this is your last session, right? The 30th one, and hopefully I can do justice to it. Well, what I'll be talking about is my own perception and about religiosity, spirituality, and palliative medicine, and how I actually do it, because I practice it with a passion. And I'll share a few case reflections along the way, and I hope I can do justice. The slides are not moving. Okay. So, as George Eliot had said, it is seldom a medical man has true religious views, for there is too much pride of intellect. So, in this session, I mean, everybody is a doctor, or hopefully there are non-doctors as well. And if there are...
Mixed group.
Oh, great, great. So, because you see, once we study medicine, we are taught something different. We are sort of programmed. This is what I feel during our whole stint at medical college, and thereafter we are programmed to believe that death is something very bad, you know, and we need to fight death, and if death overcomes, then we lose the battle. Sadly, it is not so, because we need to realize, as I said, that death is physiology. Death is natural, isn't it? And death is not pathology. So our views have been programmed. If you just go back in time, and when you were a little child, you know, sitting in your grandmother's lap or your grandfather's lap, and then your grandfather or grandmother would tell you nice stories, you know, fairy tales. There was a big Rakshas, and there was this big, you know, Superman or whatever. And then we used to sit in those laps with wide eyes, and we used to believe everything that they said, isn't it? We used to believe everything without a single figment of doubt in our minds, because our souls were pure at that point of time. We were pure because we had the art of believing. But sadly, as we tend to grow up, the only thing which comes to our mind is disbelief. So if anybody does you a favor nowadays, the first thing which you would think is, why did he actually do so? What is his intention? And so on and so forth. We have learned to question everything rather than, rather than the blessed art of believing. So sadly, this whole art of questioning, although I say this questioning and research go hand in hand, because unless you question, there is no research. But sadly, during this thing, we have lost that pure nature, that pure God-made nature which God had, gifted us. So somehow, so many layers of pride, so many layers of ego, so many layers of wickedness and evil have come upon us, and we have somehow lost our true nature, the true nature of divinity which we have, which all of us have within. What we need to realize is that illness is a spiritual event. It grasps person by the soul and by the body and disturbs them both. It raises troubling questions of a transcendental nature about meaning, value, and relationship. And this all of you must have experienced at some point of time or other, and especially in this COVID scenario when most of you were down with COVID, alone, isolated, and then definitely you would have had so many questions, disturbing questions about meaning of life. What is the meaning of life? Why is this happening to me, and so on and so forth. So illness or any misfortune actually makes you more spiritual. They say unless you polish a stone, it doesn't shine. So similarly, you see, the Lord, he blesses us actually by giving us sorrow, by giving us challenges. That is the blessing, because that is the rubbing of that stone to make it shine. So as you see, illness is one of those events which forces you to sit and contemplate about life in general, about what is life, and what is the meaning of life, and why are you alive, and why are you suffering, and then you try to find out the answers. And this is the beginning of a spiritual journey for most of us. So here, if you see this picture out here, this was one of my patients. He's no more now. This is his daughter-in-law. This is his son. And they are both, taking care of the father out here. But you see in the background, you can see the photos of gods, photos of all the family members. And this is what gives this old man who was bedridden, terminally ill, this was what gave him a sense of meaning and purpose in life. So for this person, gods and the family meant a lot. And that is where he found his meaning and purpose, right? Everything needs to have a sense of meaning. See, if you are working in an office or in your workplace, suddenly your boss sits and screams at you for no apparent reason, then you would feel really bad, or for no fault of yours, if you are ticked off continuously, or if you are screamed at, you won't feel good at all. But if there is a reason, suppose you have not attended your duties and your boss, scolds you, then at least that is okay, because you know that I have not done this, so that is why I have got this. So illness is something very similar. You would sit and want to reflect as to why me? Why did I get this illness? And what is the meaning of all this? And unless you find a suitable answer, you continue to suffer. And that is what, in short, is spiritual suffering. That is the essence of spiritual suffering. I hope you can understand that and come to terms with that. But the answers would not be very simple. The answers would vary from person to person, situation to situation, culture to culture. So what you sitting in maybe India would perceive an answer based on the local culture and the social practices. A person sitting in, say, China would perceive it in a different way, and a person sitting in Iceland would perhaps perceive it in a different manner. So spirituality is something which is very personal, and it is influenced by the local social, cultural factors. Now, the physician's own belief system, whether spiritual, religious, or none, affects medical decision making consciously or unconsciously. So you as a treating physician, or you as a healthcare provider, or as a volunteer, or whatever, your own belief system, whether you're spiritual or not, whether you accept the other person's belief or not, or whether your belief system is so strong that you try to modify the patient's belief system, all these will actually have a bearing on how you change or how you tackle the patient's spiritual concerns, right? So unlike other systems of medicine, by which I mean other problems, like most of the other physical problems, which you know that these are the diagnostic points, and I can come at a particular diagnosis, and then there is a fixed set of medications which I have to give. But here you see, when you are addressing the spiritual concerns of a patient, especially who is dying, so first of all, you have to try to find out what are the patient's own spiritual concerns based on his or her local cultural, social factors, religious factors. And then your own religiosity, your own belief system. Suppose you are an atheist, you don't believe in all this. And then if the patient says, no, I want to do a bit of prayer, and then you will say, well, what prayer? Prayer is useless because you are an atheist. You don't believe in prayers. So you would not, or perhaps discourage your patient to, to pray. That should not happen, right? So the physician's own belief system, whether spiritual, religious, or none, affects medical decision making, whether it be consciously or unconsciously. So this is where you need to be very mindful. This is where addressing spiritual concerns is totally different from routine diagnostic practices and routine therapeutic practices. This is where the difference comes in. And this is where being a spiritual physician is 100 times more difficult than being a simple physical physician. Physical means addressing the physical aspects of the body, right? So because here you're not only addressing the patient's belief systems, you're addressing your own belief systems, be it consciously or unconsciously. And nowadays there is a new terminology which is coming up, which is called mindfulness. Mindfulness basically means minding your own thoughts. What are your own thoughts, and why have those thoughts come in, and where are those thoughts going? So minding your own thoughts and thought processes, that is being mindful of your own actions, right? So this mindfulness becomes very important while addressing spiritual concerns or while addressing spiritual suffering of a patient. Now, I hope most of you have seen this image. This is a image which is taken from the Hindu Purans. The Purans, the Purans are quite old texts in Hinduism. And this is one of the avatars of Lord Vishnu. And you can see the Lord Vishnu, this is the Varaha avatar of Lord Vishnu. And he's taking up the earth on his snout. Now, this image would easily be at least 5,000 to 6,000 years old, if not more. A minimum of, let us, for example, say it is 5,000 years old, okay? Now, if you just think how long ago did the Western civilization actually confirm that the earth was round? Hardly 300 to 400 years back. But you see here, our ancestors already knew and had documented that the earth was round in this very image more than 5,000 years back. right? So what I want to say out here is that do not rebuff, or do not just consider what our ancestors had done, all the work that our ancestors had done in the past. Do not take them to be for granted. They also have a meaning. They also have something very significant. So what I basically want to say is that all religions have very ancient texts, and those guiding principles in those religious texts can be very important. So you might be a non-believer, you might be an atheist, that is fine. But please do respect the patient's belief systems. We also need to realize that the visible light covers only 2% of the electromagnetic spectrum. So what we are seeing, the light which we are seeing, represents only 2%. But that does not mean that the 98% of the light which is not visible does not exist. It still exists. 98% of the light still exists, although we are just seeing 2%. And this is something like knowledge. What we understand, or what we think that we understand, is hardly 2% of the whole thing. There is still 98% of knowledge out there which we don't understand, or which we have no idea of. It's also been said that it is a grievous mistake to keep a band of separation between medicine and religion. There is a division of labor, but a unity of spirit. The act of healing is the highest form of imago Dei. So when we talk of suffering, because disease, illness produces suffering. And whenever there is suffering, there the spiritual factor also comes in. It is not only the physical body which suffers, but it is the body-mind complex which suffers. Right? So if you say, no, I will just treat the body and I will not treat the mind, that is where you start failing. Right? You need to be holistic in your approach. This picture, I believe that in my last lecture also, perhaps I had displayed, but anyway. So this was one of my very young patients. She's no more now. And she used to come in. If you see very carefully, see the large tumor. She had a large tumor in a bone, an osteosarcoma, which was rapidly growing. And it had already spread to her lungs and everything. So when her mother used to bring her, and whenever she used to come, she never used to look up at me. She used to just keep sitting, watching her feet, staring at her toes. So one day I decided, no, even I will sit with her. So even I kept sitting, she kept sitting, and her mother kept sitting in the same room we were sitting, and it was already almost half an hour. And she still wouldn't look up at me. And then finally I got this box of chocolates, and I gave her this big box of chocolates. And around 15 minutes later, she looked up at me. And that day, I told to myself, these were the most beautiful eyes that I've ever seen in my life. This photo doesn't do justice to her. And then, when I asked her, what hurts you most? And that day she became my teacher. You know what she told me? She said that whenever my mother looks at me, she starts crying. And that is what hurts me the most. So it was not her own physical pain which used to hurt her. She used to be hurt when her mother used to look at her and cry. So that was a great teaching for me. So here, her own physical distress was immaterial to this little girl. For her, it was the distress of her mother. It was the sadness of her mother while looking at her that caused her more of a suffering. So physically looking at this patient, one would feel that, oh, she must be in severe pain because of this huge tumor. But no, you see. So these are teachings. These are teachings, and we need to learn from all this. Now, The American Cancer Society, very proudly it announced that available scientific evidence does not support claims that faith healing can actually cure physical ailments. They say the faith healing is bakwas. Death, disability, and other unwanted outcomes have occurred when faith healing was elected instead of medical care for serious illness. So they clearly say that no, all these faith healing systems, prayer and ritualism, these are all useless things. Now, if I actually say that death, disability, and other unwanted outcomes have occurred when chemotherapy was elected instead of faith healing for serious illness, will I be wrong? The same thing happens when you give chemotherapy. Death, disability, and other unwanted outcomes have occurred when you are giving chemotherapy, when you are giving radiotherapy, when you are doing unnecessary surgery, when you are doing unnecessary interventions in a person. Doesn't it happen? Then on which grounds can you actually say that death, disability, and other unwanted outcomes just occur when faith healing is elected? So questions, we can always point, just throwing stones at somebody else is the easiest job. Pointing out mistakes is the easiest job. Now, more than 80% of the population has religious faith. All religions believe that God or a superior force can intervene for the prevention and treatment of illness as a response to personal prayer, meditation, reading of sacred texts, or healing services. Some groups empathize dependence on prayer with advice not to take medical treatment. So we have such issues where so many religions or so many we have sub-religions also, right? So various groups like the Jehovah's Witness, they wouldn't take blood transfusions. So that is fine. That is their faith and that is their autonomy. So when you're talking about spirituality and religiosity, the question of ethics also comes in. Autonomy is what I want. This is my body, this is my suffering. So I should be able to decide what happens and not somebody else. So autonomy is important. And similar, something happens during the Santhara. If you're aware of Santhara practice, the Jains, they willfully stop eating and drinking, when they are actually giving up their body. Right? When they want to die, it's a willful thing, Santhara, and it has a legal sanction now. You cannot prevent them from doing Santhara. So definitely in some religion, they have certain practices which you also need to respect. Everything cannot be answered by a scientific response, right? Because you see, you believe in science, I too believe in science, but there was a time when the church was more powerful. In Europe, the church had the final say. And then there was the revolution in which science gradually gained popularity. But now again, the pendulum has perhaps swung too far. Now, what exactly is religion? Religion comes from the Latin word religare, which means to bind together. It is a structured belief system that addresses universal spiritual questions, right? So suppose we all in this group, there are 34 participants in this group right now. And suppose we sit together and say, okay, we are a group now and we will worship XYZ God. We will call him XYZ and XYZ is our religion. So it's a structured thing. We all sit and decide that we will follow these practices, and then it becomes a religion. So religion basically is man-made. You may believe in religion, you may not believe in religion. That is your choice because it is a man-made thing. We need to realize that. Whereas spirituality is something which is embedded within you. It is embedded within you, right? Spirituality is whatever the most easy definition or the definition which I use, that is what I have given out here. There are so many other definitions of spirituality. You can look it up in any standard textbook. Spirituality is what gives you a sense of meaning and purpose in life. Whatever gives you a sense of meaning and purpose in your life is your spirituality. Looking at a flower makes you feel very happy and content. So that is your spirituality. Looking, cuddling your wife gives you happiness. So that is your spirituality. Fine. Praying in a church makes you feel very happy. That is your spirituality. So spirituality is embedded within all of us, right? So spiritual issues often surface during end of life. As I said, the Lord blesses us not just by good things. It blesses us by giving us challenges so that it makes us evolve. Because unless there is a challenge, we won't even get up. We are lazy creatures after all. So when there is a challenge, we evolve, right? And that evolution brings about the goodness within us, right? And that is spirituality. So we need to realize that not all are religious. You might be an atheist, that is fine. But everybody is spiritual. Not all are religious, but everybody is spiritual. Now, this is another example which I'll give you. This was a gentleman with lung cancer, and we were treating him. This is a very old photograph again. And here, this is his wife, and this is his daughter, and this is our nurse out here. Now, this gentleman, he was so insecure. He was terminally ill, but he was so insecure. Basically, he used to stay with his wife in a flat. And he was so insecure that his wife, he would never leave his wife out of his sight. To the extent that when his wife used to go to the washroom, she had to leave the door open because this man was so scared. And then we tried to find out why, what is the source of this fright. And he being a Hindu, he had realized that gradually his life is coming to an end. And he had a son as well. He had a son and a daughter. This is his daughter in the black dress. And he had a son also. The son is not in the picture. Because he had a fight with his son quite a few years back. And so his son was now staying separately and they were not on talking terms. But when this gentleman realized that he was dying, in the Hindu practices, it is said that the pyre, the mukagni, chita, the pyre which is the body when you set fire to the body, it should be done by the sun. And if it is done, the mukagni they call it, if it is done by the sun, then you attain heavens. So his main chinta was, his main thought was that when I die, who is going to do the mukagni for me? And that was his source of distress and that was his source of anxiety. And he was under the impression that everybody would just, leave him and go away. So that is why he never used to leave his wife out of his sight. But then when we got to know this gradually over many visits, then we talked to his son and then his son came back, that there was a reconciliation between father and son. And then the spiritual suffering of the father gradually disappeared. And he was finally, that source of anxiety was gone. So you never know where the source of suffering lies unless you keep persisting and you have to be a detective like Sherlock Holmes or Byomkesh Bakshi for that example. Religion and religious traditions serve two main prime functions. The first is to provide a set of core beliefs about life events, and second is establishment of an ethical foundation for clinical decision making also. Because whenever you make a clinical decision, your clinical decision should be based on a few ethical principles also, like non-maleficence, beneficence, autonomy, and justice, right? So when you're focusing on these ethical principles, you have to take into account the local religion, the culture, the social factors, the cultural factors, everything you have to take into account. And only then can you arrive at a decision which is appropriate at that particular point of time. So a decision which is taken today might not be appropriate after 3 months, because then the priorities will have changed. So a continuous review of the process, the spiritual concerns which is there today might be different, a couple of months down the line. So what is the role of religion in suffering, in illness? It helps to cope with stress. 9 out of 10 hospitalized patients use religion to cope. It acts as a buffer against depression and speeds recovery from emotional disturbances. Associated with positive emotions and a good quality of life, related to lower rates of alcoholism, drugs, crime, and actually better school grades. So it makes sense teaching your children the essence of religion to make them participate in religious activities. Actually, they have better school grades, and socially it is better because lower rates of alcoholism, drug abuse, crime, related to healthier lifestyles and fewer riskier behaviors. So good, good, good. All the boxes are being ticked. Religion is actually good. Use of fewer healthcare services, lower rates of hospitalization and long-term care, greater marital stability, actually greater marital stability, enhanced family relationships, more social support because you are part of the religious community. So you have social support, more social support. Now, the question which we doctors and healthcare personnel actually want to address: does religious attendance prolong survival? So yes, it does. And how? So there's a study. You want evidence for everything. You no longer believe, because as a grandmother, if I tell you, no, there is a Rakshas, there is a Devta, you won't believe me. So you want evidence. So here is your evidence. So Harold Koenig in Journal of Gerontology, older adults, particularly women who attend religious services at least once a week, appear to have a survival advantage over those attending less frequently. And the p-value is less than 0.0001 for women. Highly significant for women, and still statistically significant, less than 0.05 for men. Right? So why more for women? Because women are actually more spiritual than men. Men's intelligence level is emotionally, they are little less developed than women. It takes the woman, emotional intelligence is more. Definitely, many studies have shown that they attain a state of emotional maturity faster than men. So coming back to the main question, does religious attendance prolong survival? Yes, it does. Religion and physical health, less stress-related medical conditions, lesser amount of cardiovascular, cerebrovascular accidents, strokes, hypertension, metabolic disorders. Actually, 7 to 10 years of additional life compared to non-believers. And that is a great thing going, you know. Slowest progression of cognitive impairment, less functional disability with aging, and faster functional recovery after surgery. Wow. And actually, in our hospital, I put it into good use. So all the patients who would come in for surgery in the pre-op holding area, we regularly conduct prayers, you know, in a very neutral prayer, it was, which addresses all religions. So we use that song, you know, Itni Shakti Hame Dena Data, Man Ka Vishwas Kamjor Hona. So that music is, you know, played on a microphone, and that boosts up. I mean, we would see all the patients who are in the pre-op holding area posted for surgery. They would, you know, fold their hands, or some would close their eyes. Some actually sit and cry out there, weep out there. So definitely it helps, believe me. So the question still arises that will we die in a manner consistent with the way we lived, which respects our personal values, spiritual beliefs, cultural background, and preserves our dignity? So have you actually thought about where and how would you die? And have you made any plans for your death? Have you invested in your death? No. It's high time. So here, this slide I've just put to address the quality of life. You know, this is in our hospice only, where we had a special program for the elderly, celebrating life basically. And this is another example which I'll show you about spirituality. Now, this elderly lady, you see, She had a huge ovarian malignancy, pretty much advanced, and she traveled all the way from Tripura to come to Calcutta to be with her daughter. This is her daughter. Her daughter was pregnant at that time. She was around 6 months pregnant when this lady came down from Agartala to Calcutta, because she wanted to hold her grandchild in her hand before she died. So that was her spirituality, because she felt that unless I hold my grandchild, I cannot die in peace. So for that lady, that was her spirituality. And we went out of the way to ensure that she survived till that point of time. And we made it possible for her. And you see the look of contentment on her face as she is holding her grandchild. A few days later, after this photograph was taken, she passed away. But then that was her spirituality. That was her calling. Then we also need to be aware of behaviors that erode patient dignity, like relationships of inequality or treated like an object or without respect, wishes not honored. Most important is loss of control over bodily functions. So would you be happy to die, lying in your own piss, lying in your own shit without any control? Loss of ability to choose, dying in pain, alone, dying alone, isolated, where there is loss of meaning or purpose in life. So these are all things which actually erode a person's or bring about a huge sense of anxiety and fear in a patient during the dying phase. And these are the areas which you, if you can address these areas and reassure the patient that they would not be alone, that you would be there at their beck and call, that itself reinforces their sense of control over their own systems. So how would you know that, or how would you suspect that your patient is having spiritual pain or spiritual suffering? Suppose the patient is having pain, constant and chronic pain. You keep on giving medications, this, that, and still the patient says, no, there's still pain. I don't like it, and I can't sleep. Your medicines are not working. So continuously, in spite of changing medicines and increasing the doses, this, that, then you need to start thinking that perhaps there is another component which you're missing out. Insomnia, withdrawal, depression, guilt, self-loathing, that I'm not a good person, I'm a bad person at heart, and that is why I'm being punished for what I've done, and so on. Conflict. The patient is always fighting with everybody in the family. He has a horrible temper, he's throwing things, tantrums, hopelessness, lack of sense of humor. You're giving him your best joke, which is guaranteed to make everybody laugh. And after you have said the joke, the patient is sitting glum, right? No expression on his face. So lack of sense of humor, unforgivingness, despair, fear, dread. So these are things which would point you out in the direction that perhaps the patient is having spiritual suffering. And then we need to realize that there are universal spiritual and existential needs. Everybody has them. You also have them. The need for love and authentic connection, need to understand and transcend suffering. As I said, whenever you undergo suffering, there has to be a meaning and purpose for that suffering. And if that question is unanswered, then the suffering doesn't go away. The hope to find refuge or a source of peace, the need to find a meaning in life. And this is the photo of my guru in palliative medicine, Professor Uchak from Poland. And this is where I had my initial trainings in palliative care. And he is with a patient in India, and she too wanted to hold her great granddaughter before she finally passed away, and we could make that possible. So this is another picture from, I basically practice in a rural setting and in villages and all. And this is a picture out there. So this is the husband, the elderly man, and this is his wife who is bedridden now. She cannot walk because of disabling osteoarthritis. and severe low back pain. She cannot walk. Initially she could crawl, but now she can't even crawl. And her husband has been blind now, completely blind since the last 1 month. So before he was completely blind, he used to literally drag his wife when his wife wanted to use the washroom. Basically, there was no washroom. She used to go to the fields. So her husband would guide her, you know. But now when the husband became totally blind, they have children, but the children do not stay with them. So just basically the elderly husband who is now blind and the wife who can see but cannot move. And this is what is going to happen to most of us, actually, you see. In modern times, do you really expect that your children would support you when you're old and infirmed? Do you expect that of your children? And if you expect that from your children, then perhaps you need to actually rethink about your plans. So coming back to this lady, you see, she's sitting on a charpoy. The charpoy has huge holes. So what this lady used to do, she just used to lift her sari and she used to relieve herself. She used to piss and pass stools sitting on the charpoy because there was no other option. Because the husband was not in a position to take her anymore because he himself couldn't see. Religious coping. Efforts to understand and deal with life stressors in way related to the sacred. So you try to connect or you try to explain your suffering by using your religion also. And this is where the priests or the chaplains and all come in very handy. They would help you cope, right? So religious coping serves multiple functions like search for meaning, identity, intimacy, control. It is multimodal, involves behaviors, emotions, relationships. It is multivalent, like bitter and sweet. That you might say that, oh, it is just because that I did so many bad things, that is why I am suffering. Because my religion says that if you do bad, you will suffer. So that is why I am suffering. So that is a negative aspect of your religion. A positive aspect is that yeah, I am suffering, but because of my suffering, I have come closer to God, and I'm sure that God will help me come out of my suffering. So that is a sweeter aspect of the whole thing. There are two ways to see any picture. So again, this is again one of my patients, and I was trying to bring about a sense of meaning to her suffering. You know, she would keep on asking me very distressing questions about her existential suffering. So principles of spiritual care. Spirituality is an essential component of each person. It is an ongoing issue. So what is true about what spiritual concerns that the patient has today, that can change over 1 or 2 months. So you need to keep on readdressing it. Demonstrate respect for patients' values, autonomy, vulnerability. Do not impose, as I said earlier, do not put forward your own beliefs. Do not try to teach the patient principles of your religion. Do not try to convert the patient. Know yourself. Because unless the story begins by understanding your own self, who are you? What about your suffering? How are you handling your suffering? Are you at peace with yourself? See, you cannot pour from an empty glass. If I ask you for water, the first thing you have to fill up your glass yourself, isn't it? So unless you have love within, unless you love yourself, how can you love others? How can you give that love back to others? So knowing yourself is very important. And so physician, heal thyself. And I too had ventured in my own journey of trying to find meaning and purpose in various places, in various ways, in various little pilgrimages. So knowing yourself is a part of the whole process, because unless you know yourself, your journey doesn't begin. So all of us have our inherent spiritual resources, the capacity for love and authentic connection, to understand and transcend suffering, to find a refuge or a source of peace, and to find meaning in life, right? So meaning in life, and how you can transfer that meaning and love to others. Your positivity, how can you transfer your positivity to others? Your vibrations, your positivity, your good faith, your prayers for others, right? So there is spirituality wherever you see it. So wherever you look for spirituality, you will find it. And even in this boy who is bedridden, you see spirituality, religiosity, somewhere or the other, you will find little signs of that lingering in different places. And here, this was a Muslim patient, and this is in Barakpur, in the suburbs of Calcutta, and I was addressing his spiritual concerns. But now you see how meaning making and spirituality doesn't just stop at religion. It can transcend religion, anything which gives you a sense of meaning and purpose in life. So as I said, this was a Muslim gentleman, and the next image, you see, this is a close-up. So although he used to follow Islam, but then there are some Hindu practice books also which he used to actually believe in. So when the search for meaning and purpose, the search for meaning of why you're suffering, can actually transcend your own religion and spill over into other religions also, which is fine. So this is Adi Guru Shankaracharya in Hinduism, and he had quoted that Jantu Nam Narajanma Durlabmata. So he had said that amongst all the living organisms, amongst all the living creatures, it is the human birth which is durlabh, which is very precious. You know why? Because it is only in human beings that they have the power of discrimination. No other living being has the power of discrimination other than human beings. So discrimination, to decide which is good, which is bad, why this is happening to me, right? So that power of discrimination, so that is the spiritual part of our nature that sets us apart from other creatures. And that is why Adi Guru had advised that we should make the best of this human birth of ours. We should put it to good use. So I'll give you a bit of perspectives from different basically three major religions, which I currently am aware of. So in Hindu perspectives, in the Bhagavad Gita, it is very clearly said, those who remember me at the time of death will come to me. Do not doubt this. So this again reinforces the importance of prayer and focusing your mind on the Lord at the time of death, right? So this again has many ramifications, which I personally use in my clinical practice also for willing patients, because I actually went a step further and I trained myself in ritualistic practices also, like ritualisms, how to do puja. And because patients would keep on asking me, what should I do? What puja should I do? So I said, why not walk that extra mile? And then I do it on my patients who agree to do it. And if you ever come to visit my hospice, you will understand what I'm talking of, because my hospice has actually 3 mandirs within the compound, which I have built because there was such a need of that spiritual and religious support. I needed God's support, and I got it out there. So I'll skip this. So here again, there could be so many ritualistic practices like giving Ganga Jal before death. So that is again an intersection of culture and spirituality. Then if you come to Islam again, they say when the believer is afflicted with pain, even that of a prick of a thorn or more, God forgives his sins and his wrongdoings are discarded as a tree sheds off its leaves. So here again, meaning making, when you're suffering, when you have physical pain, severe pain, suffering. So you think of it that that the Lord, that Allah would definitely forgive your sins and wrongdoings. So this is again, all religions in some way or the other, they give you a path for meaning making so that you can correlate with that, right? And Abu Zaid al-Balkhi, he stressed the importance of combined treatment of the body and soul, looking at beautiful pictures and listening to beautiful music, like which you have art therapy and music therapy now, which is coming up. So all this, in illness, seek Allah's help with patience and prayer, increase remembrance of Allah to obtain peace, ask for tawbah, give more in charity, read or listen to the Quran. And these are the things which I use practically in my Islam patients who practice Islam. I give them this advice. And this is directly taken from the Islam perspectives. And Christianity, most of the work on religiosity and suffering has been done in the Christian faith, documented evidence. Sin and death are the predicaments from which we seek salvation. Our predicaments are ontological. The cure of this predicament cannot come through human power alone, and the power of God can help. Here again, the same thing, that the God, you have to take his help. You have to take his help. So all the religions, directly or indirectly, would offer a platform through which you can help to make a sense of meaning of your suffering so that you can transcend that suffering. So what is the downside? So we have till now talked about the benefits of religion. But downside, high religious coping, receiving more aggressive end-of-life care. So perhaps there were some cases where they wanted more aggressive end-of-life care. No, keep on doing, put me on ventilator, put me on this. There were studies, right? So that is a flip side. So here, this is a patient from Kolkata, very actively dying, and music therapy was given by volunteers. And in the end, this lady who in her younger days used to sing Rabindra Sangeet, she actually started singing. She actually sat up in the bed and she started singing, and then she started crying. And this is her daughter-in-law, and this is her granddaughter. So the power of music therapy. So many therapies. Just don't think that it is all about medicines. Just don't treat the physical body. The physical body is just a part of the body. There is a mental body, the psychological part, the spiritual part, the cultural and religious part. These are important parts which we need to address. So how do I do it? So first you need to recognize that the person is suffering, that is sympathy. Respond with feelings of empathy, and then being a compassionate presence. Okay, so then you have to show compassion, that is to relieve the suffering. Presence is awareness and kindness. Shift from doing to simply being. It is not that every time you go there, you have to do something. It is not that every time you visit a patient, you have to give some new medicine. No. The patient is not always coming to you for medications. The patient is coming to you so that the patient can share their suffering. So the patient has somebody who can listen to their suffering, and make a connection with their suffering. So here again, making a connection with the patients, right? So that touch is a very important tool. The moment you touch a patient, although the touch should be an appropriate touch, it should be a culturally appropriate touch. And when you touch a patient, the intention of touching is very important. And then there is a transference of vibrations. This is what I feel. I mean, it may sound very unscientific to all of you, to most of you, but believe me, I have been practicing this art now for more than 15 years, and it works. Bodies do not suffer. Only persons suffer. It is a person within that body which is suffering. When physicians deconstruct suffering to its physical dimension while ignoring the psychological and spiritual pain, they not only fail to relieve suffering, but compound suffering. So just don't be a mechanical doctor always, right? So it is not about treating, it is about healing. You need to be a healer, not a treater. Anybody can be a treater. To be a healer, you need to be blessed. So another story, but I'll skip this. And then this is something which I work with, and that is end of life dreams and visions, because I do believe in afterlife, and I do have collateral evidence of afterlife. And actually, I'm doing my PhD. I've just recently submitted my PhD thesis, again on end of life dreams and visions, and which are actually very common, and how religion and meaning making can help a person come to terms with all this suffering and how it can transcend the suffering. So this was one of my publications back in 2016. Again, this little child, you see, since this child, he had never been to schools because he had non-Hodgkin's lymphoma, and since a very early age, he used to just spend most of his time in hospitals and all, repeated cycles of chemotherapy and this and that. So he never could attend schools. And finally, he was declared terminal, and he was shifted to a hospice. So this little child always had a dream that he wanted to go to schools. So we made his dream come true, that because that was his spirituality. He wanted to go to a school. So we talked to the principal of a kindergarten school, and then this little boy, you can see we bought him this huge watch, and we bought him a little bag and a small tiffin box. He would want the tiffin box, and he used to go to school. He used to sit in the last bench, and there he would sit and have a little bit of his tiffin, and then he would draw pictures, because that was meaning making for him, because that gave this little boy a sense of meaning and purpose to his life. And this is one of the drawings which he made, crayon drawings, and we have preserved it in our hospice. The boy is no longer with us, but this was all about meaning making again through art. Art is a beautiful expression through which one can make meaning. So as you know, Dame Cicely Saunders had talked about total pain and the 4 dimensions, the physical, social, psychological, and the spiritual dimension. So it is the spiritual dimension what we are talking of today. But we need to understand that the physical dimension occurs just 25% of the total pain. So just don't focus on 25%, focus on the 75%, the social, psychological, and spiritual, which constitute the 75%. So then we need to differentiate between religious pain, which is feeling guilty over the violation of moral codes and values of the patient's religious tradition, that you didn't attend church and that is why you are suffering. So that is religious pain. Or you did not do puja, that is why you are suffering. So that is religious pain. Whereas spiritual pain, those who have concluded through their own self-judgment that there is something wrong with them at their core. That is, if the patient believes, no, basically I'm a very bad person and that is why I'm suffering today. So that is spiritual pain. Whereas religious pain, because no, you didn't go for puja, you didn't go to church, you never attended this, that, you never prayed in your life, and that is why you're suffering. So that is religious pain. And spiritual pain, so basically, no, I'm a very bad person and that is why I'm suffering. I'm very wicked, that is why I'm suffering. So that is spiritual pain. So there is a difference. So another example, I think I've given this example earlier also. There was this elderly lady, you can see the huge tumors, right? And she had physical pain, which we combated, the spiritual pain was gone. But still she was anxious. She never had this sense of complete satisfaction. She had this suffering. And then on deeper inquiry, we found out, see, this was a state of hopelessness, even after relief of physical pain. So she used to sit in this charpai, and in front of the charpai was a small kitchen garden, which she had planted vegetables and all. And in those areas, a lot of monkeys come. So she used to sit in the afternoon with little bunch of stones, and she used to throw the stones at the monkeys so that the monkeys would run away and not destroy the vegetable garden. Her main concern was that after I die, who is going to throw stones at the monkeys? Because that vegetable garden, which she so lovingly developed, that was her sense of spirituality. So spiritual concerns can be widely different and, encompass the most seemingly so-called stupid things in life. But those seemingly stupid things in life can be very important for some other persons. So respecting each other's views is also very important. So here is the kitchen garden, and she used to sit smoking her hookah, and she used to throw stones at the monkeys out there. See here, she would sit in the charpai, and that is the garden out there. So that was her spirituality. And then hope. Do not take away hope, but please do not give false hope. Because as long as there is meaning, there is hope. So as Dr. Charles Corr had said, help me. The patient starts by telling you, help me. Then he says, listen to me. Then he says, stay with me. And then he says, when I'm gone, please do remember me. Thank you. Any questions? I'd be happy to address.
Thank you, sir. Thanks a lot. So now the floor is open for the participants. So if you have any comments or any experiences to share, kindly put in the chat box, or you can unmute yourself and speak. So this is our last session, and dear participants, kindly switch on your videos. So let's see each other once again. Oh, thank you all.
Dr. Abhijith.
Yeah.
This is Ramakrishna from Mysore.
Yeah, good evening.
And thanks a lot for the wonderful session. And I think this is the second time I'm listening to you. I had come to a Guwahati conference in 2020. I think you made a presentation at the time. Probably the spiritual aspect in palliative care, I believe it is yet to evolve a lot when compared to other components of palliative care. There needs to be a lot of documentation that is required, and it should be more those knowledge, this should be more easily accessible to people who are working in palliative care. Maybe culturally appropriate and socially relevant stories which could be available in our own Puranas or Mahabharata or Ramayana. Some stories which are very, very relevant for palliative care, if that can be brought into a printed form, so that the palliative care workers can understand that and start talking about this. Even now, I believe that as palliative care workers, we don't talk much about death, even to patients who are facing the death, imminently they are facing death. there is some, I feel there is some gap is visible to me. I'm not a great experienced palliative care worker. I'm a volunteer at Swami Vivekananda Youth Movement at Mysore, working since intensely with about 6 to 7 years after my retirement from bank. I feel that there's a lot to be done about this, and some stories, if it can be brought onto the learning page of every palliative care worker, that may be very, very useful. People who work in the field. And the second thing is just reinforcing the point which you were telling. We had a similar experience of this son coming and talking to the father. But a couple of years back, we had a patient who was about 75 years old, suffering from abdominal cancer. He was in the last stages, and around 8:30, 9 o'clock in the morning, nurses saw that his oxygen level dropping, and immediately everybody was alerted, and the wife was told to get some relatives if somebody is there so that they can have a word with him. And wife kept on repeating that there is nobody available there, and she's kept repeating that only husband and wife, they were living together. And something was missing. Our nurses started probing, and then she slowly revealed that her son, daughter-in-law, and a child of 3 years, they live in the first floor. They have not interacted for the last 9 years. And our team was successful to bring that family, son's family, around 2:30 or 3 o'clock in the afternoon. And there was a superb, scenery, it unfolded before us. There was tsunami of emotion, a lot of crying and cuddling, everything happened. It was a miracle that slowly the oxygen level went up, and this patient started feeling more energy. And the next 2 days, he lived very comfortably with the grandchild. And on the third day, he passed away. Very peacefully, he passed away. This is the kind of miracle we could see how this could be possible. When the energy was depleting so much, when he started interacting with son and the grandchild, suddenly he became very alive. A person who was about to die, who came alive for the next 2 days. And on the third day, he passed away very peacefully. This only reinforces what you have been telling, that there is some other dimension, that spiritual dimension. Whatever this resolutions are to be found, it has to be found before we exit. And thank you for the wonderful session, Dr. Abhijith. Thank you so much.
Thank you, Mr. Ramakrishna. And what you said about stories from the Puranas, that I have already published. I have a publication called "For Thou Art a Hero," in which I have incorporated stories from the Puranas and how it can relate to palliative care. So it's available, I believe, on Amazon as well, Amazon and Flipkart. It's called "For Thou Art a Hero." Thank you.
Sir, I am Dr. Ajayan from Paliam, India. I want to ask 2 questions. One is, just as religious pain and spiritual pain, is there any religious death or spiritual death? What is your opinion about rebirth in relation to spirituality? That is my question.
Okay. Religious death or spiritual death? Because if you see, life and death are flip sides of the same coin. So what the definition of religious death, I really would not know, but religious death would basically mean that when you stop actually believing in your own religion. But there is nothing called a spiritual death. A spiritual death can otherwise be happening, or a spiritual distress is definitely a documented entity when your spiritual concerns are no longer being addressed. That is spiritual distress. But spiritual death, I'm not aware of such a term. And secondly, what you talk about rebirth, you said. rebirth, you said. Well, this is a very controversial area, and nowadays we are having more and more evidence, although not, we are having corroborative evidence that there is, which point to the fact that there is some life after death. These are corroborative evidences, and although those corroborative evidences are increasing day by day, end-of-life dreams and visions are one of the pointers to that, whereas near-death experiences are very well documented. And in the US, there is a particular university, I think Pennsylvania or somewhere, where a lot of work is currently being done on afterlife based on near-death experiences and rebirth stories, which little children who have had rebirth, where they remember where they were born before. So these type of works are actually being done, research is being done with a great amount of zeal. So maybe in the coming week or so, we can have some, inferences from those studies. Thank you.
So we have 10 more minutes. If you have any doubts, kindly put in the chat box.
Can I?
Yeah, sure, sir.
My question or my query is, do atheists also have some issues? And how do you address their issues?
Yeah, of course. Atheists will also, because after all, we are all human beings. As I said, religion is something which is man-made, right? So a child, a newborn child, he doesn't belong to any religion, but still that newborn child, once he starts growing up, before he is even exposed to religion in a big way, he would definitely have some spiritual concerns. For a newborn child, his spirituality or her spirituality would be his mother, would be the want for food. So that are the concerns which bring about a sense of satisfaction, a meaning and purpose to the life of the newborn. So spirituality is something which is inbuilt in everybody. So it doesn't matter whether you believe in religion or not. You might be an atheist, but definitely you are spiritual. Every person has something or the other which gives them a sense of meaning and purpose in life. And these spiritual concerns can keep on changing with time. What gives you a sense of meaning and purpose when you're young would differ from what gives you meaning and purpose in your current state of life, and it will keep on changing. So spirituality is something which is inherent in every person.
Thank you, sir. Thank you so much. So I hope there are no other comments. So thank you so much.
Yeah, I have one, Madam Gayatri.
Sure, sir.
I should really appreciate yourself, Madam Rajashmi, and the entire team of Pallium for having conducted this workshop so nicely, making every session very, very interesting. Of course, personally, I'll not be able to say thanks to all the faculty who really participated in this. On behalf of probably all the participants here, I thank you all, the entire Pallium team, for having brought this to us in a wonderful, the design, their delivery was very, very good. And thank you so much. We are really indebted to you. And should there be some occasion to come to this, Pallium Day, definitely I'll be trying to find a reason for that. And now after going through the session, now I'm very, very keen that I should visit Pallium Day once. I'll be definitely coming to your organization to witness what is being done.
You're always
Thank
welcome,
you so much.
sir. Thank you, sir. Thank you so much. And I should personally thank you. Thanks a lot for your active participation, and your enthusiastic face was a great motivation for me even to attend the session. So thank you so much.
Thank you.
Thank you, Gayatri. Thank you, Meenam. Sri Devi, Raji, and everybody in Pallium team and everybody. Thank you so much. We had a good session throughout. Take care. Happy New Year to all of you again.
Thank you, ma'am. Thank you. Thanks a lot.
I'm sorry to interrupt, but what's the name of the book that Abhijit's book?
You mean those that book?
The one that you said that's available on Amazon.
Yeah, actually, I have till date I have
Can
four
you-
publications. Four
It would be
publications.
lovely if you could send the link over. You know, I was really interested in the
A link.
link or the name to the
Yeah,
Pallium. You can share it with us.
I'll just type it in.
Yeah, lovely. I've asked it twice on the chat. Nobody bothered, so I had to interrupt. So sorry.
Oh, I missed it. I'm just typing.
Thank you so much.
Gayatri, can you please put it in the Echo group itself, so that will be more handy, because this chat might not, we might not get it later.
Yeah, sure, ma'am.
So I've put in the names of 3 books. You can either find them on Amazon or Flipkart, those sort of things.
Lovely. Thank you again. Thank you, everyone.
So thank you once again. So we were all together for the past 9 months. So I had a very good learning experience that we were able to see a lot of people from different parts of the country, and we were able to share a lot of thoughts, a lot of knowledge. So thank you all, and it was a great opportunity for me to work with you all, as I was always able to see a lot of enthusiastic faces on every Wednesdays on the screen. So thank you all. Thanks a lot. And we are actually correcting your assignments, and we'll be sharing the score with you all soon. And we are sharing the feedback link, and kindly fill it up. Thank you. Thanks a lot. See you all soon. Thank you.
Thank you. Thank you all.
Thank you all.
Thank you all. Thank you, Gayatri ma'am, and thank you, Abhijit sir, for this session. I'm Senior signing off from this session with Gayatri ma'am. Thank you, all of you.